Hi everyone, it's Chief Trout, and this is the Assessments tab video for our series on ESO documentation. The Assessments tab is just what it sounds like. It's where we put the assessments that we take of the patient, right? So when we do our head to toe physical, all of that stuff, including things the patients say, how they're mentating, if they're hallucinating, all that stuff should go in the Assessments tab. So when we're in this Assessments tab, we have our green Add Assessment button down here. Now, when we add that assessment, we have our assessment time, our date, and we also have these options over here, which we'll cover here in just a few minutes. And then as we click through the boxes, we can start entering information. So for example, mental status, maybe they're at their normal baseline because they're an elderly patient with some dementia, so they're always a little confused. Maybe they're alert and oriented ×4, or maybe you click in here and you go into findings, you can put some very specific things like, oh, maybe they're a little agitated, combative, and confused, but no hallucinations or anything else that might be clinically relevant. And then just, again, make sure you hit OK after you make your selections. The other thing you can do is put in some comments in the free form data field. So patient swings arms at EMS providers when they get close, right? So that way you can better explain the different selections you made in your findings. You can go down to skin. Again, there's always going to be these quick check boxes, right? So no abnormalities, or maybe they were a little clammy, a little cold, and a little cyanotic, right? Same thing, your freeform field. Head, eyes, ears, nose, throat. That's what that means. And you're able to go in and select a few different things. Chest, you have your lung sounds in here. So maybe they were wheezing, maybe it was expiratory and inspiratory in this left upper quadrant. Maybe in the right upper quadrant, it was the same. And then maybe in the lower quadrants, it was actually just a lot of rhonchi as well. Maybe they were short of breath. So you come up here and say, well, they had some accessory muscles used. And let's say maybe they had an implanted pacemaker. And then down here, you could also say, and speak more about the chest and the lungs, saying, patient has increased work of breathing, accessory muscle use, 2 to 3 word sentences, or what have you. Or maybe the patient's complaining of shortness of breath, but they speak in complete sentences. They speak continuously. They're yelling at you. Whatever you need to put in there to help better explain the findings that you're documenting. We have the same for abdomen, back, pelvis, extremities, and the extremities get broken down into even further: right arm, right shoulder, the upper arm, the elbow, forearm, wrist, so on and so forth. And then your neurological findings as well. Now, I want to take this opportunity to explain the importance of these different switches in the findings. These allow us to create data points, which we later use to see how our care is actually impacting the patient. And furthermore, if you remember the conversations about ORMSIS and NEMSIS, and even the hospitals, they're using these data points to help them create reports and justify different funding mechanisms that they're going to use for patients or what have you. So it's really important to have this information and have it in there accurately. A few other features in the assessment tab are these selections up here. So You have your quick assessment. See that lightning bolt looks really similar to this other lightning bolt. And come up here and do your quick assessment. Yeah, their mental status is normal. Their skin was normal. You know, neurological is normal for baseline or what have you. Maybe you did actually find something in their head, eyes, ears, nose, and throat, and you want to put in some different findings. So maybe drainage and facial droop or what have you. Then the other thing is this anatomical. Now, this is really cool and really helpful if you have, let's say, that trauma patient, or you have a wound or something like that, where maybe you don't know exactly where to put that information in the previous screen, or maybe you just struggle a little bit with your anatomy and you're still working on that. So let's say I have a contusion, right? And contusion is just a fancy word for a bruise. So I can come over here and click contusion, and then I can show where it was at. Well, it was on this thigh, down here, and then they also had one on this bicep, on the upper arm, right? And you can do that with a whole lot of things here: gunshot wound, fractures, burns, amputations. And then when you click OK, those things end up in our assessment. So now we have the ability to quickly input that information if we don't want to go to each different click box and click. The other thing we can do is down here, after we add our initial assessment, we can add our ongoing assessment. So basically, you know, we got there, we assessed them, maybe we weren't able to assess a whole lot, or maybe something changed. We can add that ongoing assessment, and that ongoing assessment copies everything over from your previous assessment and just changes the time. And then you can go through and say, well, yeah, actually now they're alert and oriented and they're not so agitated. You know, there was no abnormalities on their face or eyes, their head, maybe, you know, breathing improved, work of breathing decreased after doing that. All of these things help paint a better picture of what's going on and provide a much clearer documentation to be used to help justify what we do.